Senators, I rise today in support of SB 101, and I want to begin by thanking our Chair Wiener and our Pro Tem for their long hours of negotiation and deliberations with the Assembly and in the coming days with the Governor's Office. I also want to in particularly give a very special thanks and shout out to the staff for Budget Sub 3 for their hard work and the many hours that they have put in over the last few months. I want to begin by acknowledging some of the concerns that I do have. I agree that dipping into our rainy day funds, so like many of my colleagues, are concerning. You know, California is a home to about 40 million residents, and we believe in providing services and opportunities to all that live here. But the only way that we will be able to continue to do this is by exploring alternative revenue options. And so this too must become a serious part of our conversations, not just here in the Senate, but also in the Assembly and at the Governor's Office. That being said, this was an extremely difficult budget year, especially in the Health and Human Services Subcommittee. Many of our discussions were around the in-home supportive services and the unsatisfactory immigration status population. Additionally, so much of what we do in the Health and Human Service area is severely impacted by the federal government. Many budget cuts are augmented, backed up by federal dollars, many of which have been cut, are proposed to be cut, or are under the threat to be cut. And so unfortunately, what we are doing today is only temporary, as it looks likely that we will have to revisit the budget as a federal regime continues to target this great state. Earlier, the senator from Huntington Beach stated that California does have a budgetary problem. But I'll tell you this, it's going to get a whole lot worse based off of what the federal government is doing. You know, California gives the federal government $83 billion more than what we get back. That's our money. Billions of dollars to go to services for our residents. Within the healthcare space alone, within the Medicaid space alone, the billions of dollars that they're talking about cutting at the federal government is going to hurt our residents. It's going to hurt our hospitals. Those doors will continue to close. So yes, when we talk about what's happening with our budget, we can't just look at what's happening here because we have revenue that comes, our revenue that's supposed to come back to us from the federal government that is at significant harm. And while this budget that we present, our solutions today are no way perfect, and no one is going to ever be happy with everything. For example, I am worried about Prop 35 and whether our plan truly aligns with what the governor supported, what the voters supported. But our budget does continue to keep our promises to ensure that our most vulnerable Californians are safe and healthy, and also fulfills our legislative duty of delivering a balanced budget proposal to the governor on time. What we rejected and what we have decided to fund are in line with California values. Earlier, a senator from Fair Oaks spoke about the hope that he hears many of us talk about on our side of the aisle. And although hope is not a strategy alone, it is a powerful motivator and crucial element of a successful strategy. Therefore, we must have hope for a better tomorrow. We must have hope that our financial outlook will be improved as we continue to work to make that hope a reality. And that's what we've done. In Sub 3, in order to hold the critical health and social services Californians hold dear, let me be very clear. We will not be disenrolling anyone from Medi-Cal. I said that on Tuesday, I said that on Wednesday, and I will say it again today. No one will be disenrolled from Medi-Cal. That means no one currently covered will automatically lose their health care coverage. And some of those savings that people are wondering where it would come from can come from not enrolling any new individuals. And the senator from San Fernando Valley just spoke and said that she could not tell people to enroll because of what ICE is doing. Not going to disagree with that, but that has nothing to do with our current budget. That is what is happening at the federal level. And in the future, if anything happens, any administrative errors or individuals forget something and they become disenrolled, they will have a 6-month timeline for them to re-enroll. That's something that we put in that was not in the governor's proposal. So we are keeping the promises that we have made. Additionally, monthly premiums for the UIS population will be implemented at $30 a month and not the $100 a month. That's a 70% decrease from what the governor proposed. This budget recognizes the importance of our IHSS workers to their patients and their families, and the importance of continuity of care and how critical that is to healthcare outcomes. And therefore, we will not be capping providers to 50 hours for in-home supportive services so that they can stay with the patients that they are serving. California values our seniors and recognizes the hard work and contributions that they have made to their families, their communities, and this great state. And we also recognize our responsibility to ensure that they are not left behind. Therefore, the Medi-Cal premiums for the UIS populations will stop at the age of 60, and we increase the asset limit to $130,000, up from the $2,000 to $3,000 that the governor proposed this May. And California has been and will continue to be a reproductive freedom state, a state that others look to when they discuss women's reproductive rights and the ability to get comprehensive health care. This is extremely important to me as a board-certified OBGYN. We will hold the line against cruel federal cuts to family planning programs with this budget, and therefore we will not cut funding to family planning services. Additionally, this budget will ensure that there is oversight, making sure that the organizations and programs the state funds are held accountable. This budget will require data collection and audits to ensure the programs we fund are actually helping those that need it. This budget has been negotiated by leadership and will hold the line against those cuts which target our most vulnerable and stand in line with California's values and promises. Once again, I want to thank the leadership and the chair for their tireless negotiations and for the talks that they will have to have in these upcoming weeks. And I want to close by reminding people and restating that what is being done at the federal level is going to have massive, detrimental implications within the health and human services here in California. So unfortunately, this will not be the last discussion that we have this year on this issue. But as of right now, I'm gladly supporting SB 101 and ask for your all support as well. Thank you.